Hello, I'm Monique Hernandez. I am Clinical 1 Term 2 student. Today I'll be demonstrating a scan of the right lobe of the liver. First thing we're going to do is put our gloves on. So let's do that. And then the next thing we're going to do is prep our patient. So we're going to give her some napkins to put so she doesn't get gel on herself. Here you go. Thank you. Got it? Okay, and then we're gonna select the curvilinear probe because that is for our abdomen protocol. And we're gonna make sure our probe is set on abdomen. So it is set on curvilinear and abdomen. And then we're gonna put some gel on our probe. Like that. Then just let your patient know it's gonna be a little cold. It's gonna be a little cold. Okay, and then here we have the liver. We're gonna zoom out a little bit because it's a little too zoomed in. We have the main portal vein. We're gonna scan that. We're gonna add color using color flow Doppler. There is good vascularity. And then we are gonna do pulse wave to make sure we have a pulse in there. All the way up there. We have no angle, so we have to use angle correct and make it 60. Still trying to get to 60. That's too much. Okay, now we're just gonna center it in the middle of our beam. And that is our pulse for our main portal vein. So, and then we can freeze this, put comments. We can do we're in trans and we're right lobe of the liver. So we can add that. And then select and save. And then take it off, take color, and we are gonna unfreeze. And then next we're gonna measure the liver to see how large it is. We're gonna ask the patient to take a deep breath, please. Please take a deep breath, hold your breath. And see if we can measure all of it. Let's freeze. Then we're gonna press measure. We're gonna measure from the tip. And we press set, and then we scroll down to where this hyperechoic line is. Right above it, we want to press set again, and our patient's liver is measuring at 13 centimeters. That is normal. We're going to try and measure the size of the main portal vein. And scroll back a bit, and then we're going to measure it. And the main portal vein is measuring 7.22 millimeters in length and 6.35 centimeters in diameter. And then once we measure that, we just save it as well as a picture. Just press OK. And then that is our protocol for the lobe of the liver. So we come. And then now I'm gonna clean the probe. Well, first I'm gonna help my patient out. I'm gonna give her some napkins to clean the gel off herself. You can wipe yourself. Then we're gonna clean our probe. So we're gonna wipe all the gel off first. And then we wanna get another napkin and use the transeptic spray. You wanna spray your napkin. And you want to wipe down your probe. And then we can put our probe back. And then make sure you throw away this. And the last thing we're going to do is we're going to clean the bed. We're going to take this off. Throw it away. And then dispose of our gloves. So just a brief summary of overall what we scanned today. We did the upper right quadrant of the abdomen. We did the right lobe of the liver.